Let's begin.
Which screening prevents Rh-negative mothers from developing anti-antibodies? Which antibody class crosses the placenta and causes hemolytic disease of the fetus? Which coexisting antigen weakly expressed can complicate Rh typing known as weak D? Which result shows a person has antibodies to A and B antigens? Which transfusion practice is used for patients with sickle cell disease requiring chronic transfusions? Which analytical method separates red cell populations to detect mixed field agglutination? Which professional typically collects blood donations for transfusion? Which blood type component requires ABO compatibility for platelet transfusion in some cases? Which rare blood group lacks expression of Rh antigens entirely and can donate to any Rh type? Which component contains clotting factors and is liquid portion of blood? Which transfusion reaction presents with urticaria and pruritus shortly after transfusion? Which alloantibody specificity commonly produces a positive direct antiglobulin test in newborns? Which symptoms suggest an acute hemolytic transfusion reaction? Which test quantifies fetal red blood cell volume in maternal circulation? Which gene encodes the H antigen precursor required for A and B antigen formation?